infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. With the nation focused on the delivery of a COVID vaccine, the CDC wants to ensure that older individuals are protected against other prevalent yet preventable diseases that can lead to severe health complications and even hospitalization. They say vaccine demand declined an average of more than 60% across adult vaccines during the height of the pandemic. Now, one of those adult vaccines is Shingrix for the prevention of shingles. Well, joining me today to talk about shingles and the Shingrix vaccine is Dr. Leonard Friedland. Dr. Friedland is Vice President, Director of Scientific Affairs and Public Health at GlaxoSmithKline Vaccines. Dr. Friedland, welcome to the show, sir.
Well, thank you very much, Robert. It's a pleasure to be here. And in addition to being a vaccine research scientist, I'm also a practicing physician in the state of Pennsylvania. So what we're going to talk about today is near and dear to me because I take care of these issues, when I'm caring for patients in addition to developing solutions to keep them healthy.
Absolutely. Let's start out with something that I talked about in the intro, and that's adult vaccines. Mm-hmm. Maybe something that everybody's aware of, but what are some examples of adult vaccines and why are they important?
That's a great way to start. So there are a number of vaccines that are routinely recommended for adults here in the United States. I'll list them right now and then I'll get to why they're important. So these vaccines for adults include the vaccine to help protect against pertussis. We call that the Tdap vaccine, TDAP. It's actually tetanus, diphtheria, and pertussis, otherwise known as whooping cough. Another vaccine for adults is the vaccine to protect against pneumococcal pneumonia. There's also, as everybody's aware, the annual influenza vaccine for not only all adults, but actually everybody over 6 months of age, but very important in adults. There are vaccines to help protect against hepatitis A and hepatitis B in adults. And as you mentioned, there's the vaccine to help protect against the disease shingles, recommended for all people over the age of 50. And now, in addition, we also have the COVID-19 vaccines, which are recommended for adults in a prioritized fashion as we're getting more supply over the next few months. Now, why are these vaccines important to help protect against pertussis, pneumococcal pneumonia, influenza, hepatitis A and B, and shingles? And that's because these diseases all cause quite a lot of disease in adults, hospitalizations, lost time from work and from activities of daily living, and also, unfortunately, death. And we have the ability through vaccination to prevent these diseases in adults. And that not only results in the individual remaining healthy and living their life to their fullest, it also allows the people that they're around, their families, their communities, to remain healthier as well because they don't have to care for people who are getting sick, and they're also not spreading disease to others. So we have a number of vaccines that the Centers for Disease Control recommends for all adults here in the United States. And as you mentioned when we started, unfortunately, the demand for these adult vaccines really dropped significantly during the pandemic.
Yeah, and as a physician and a scientist, this drop in demand has to be concerning, right?
It's very, very concerning. So we wanted to quantify this. We assumed this was happening. Then the data was coming in that well visits were dropping. In other words, adults were not going to see their doctor for well care particularly during the peak of the pandemic back in last March, April, May, and also visits to the retail pharmacies were dropping as well. And so we commissioned a study with a group called Avalir. And they've now put this study, which I'll mention just a second, up on their website at avalir.com. That's AVALERE.com. And what we asked this group to do at Avalir was to actually look at what was happening with visits across adolescents and for adults, and to quantify what was actually happening there. And what they were able to show is that immunization rates, they fell dramatically during the pandemic. And this places individuals and communities at risk for preventable diseases, as I mentioned. So just a couple of takeaways from this work that was done by Avalier. It was really the first to quantify this drop in these vaccine claims. So actually, prescriptions, orders for vaccines, they were able to quantify that they dropped. And when this happens, each month that goes by, as more and more people weren't getting their vaccines, it's like a snowball effect. So millions of adults were missing their routine immunizations. And while we're starting to see now that people are going back to their doctor's offices and going to the pharmacies, it's going to be extremely difficult to recover back to where we are and regain what happened in the past. I mean, even before the pandemic, Robert, adult and adolescent teen vaccination rates were underutilized. In fact, less than half of adults in general received the vaccines that are recommended for them. But when we come back to the pandemic, getting routine vaccines during the pandemic, it's going to require now additional education and training. And that's why I'm really interested to talking to you about this, because the Centers for Disease Control recommends that adults receive all of those recommended vaccines. And maybe just to put a ribbon around this particular topic right now, what we don't want to do is let routine immunization become another casualty of the pandemic. There are so many public health things that have happened from this pandemic, and what we don't want this to also do is have this drop in routine immunizations as another casualty. So it's really urgent that we address this and talk about it and make up for these missed vaccinations.
Yeah, important topic. Dr. Friedland, before we get into the discussion on the Shingrix vaccine, let's go ahead and talk a little bit about shingles. What is it?
Yeah, so for those who've never had a case of shingles or known somebody who's had a case of shingles, let me tell you about what this disease is. It can be a really debilitating and devastating disease. So shingles is the term we use for a disease that's called herpes zoster. And what this disease is, it's a virus disease. It's caused by a virus. The virus is the actual chickenpox virus that we all had when we were younger. In fact, if we look at people over the age of 50 in the United States, 99% of people over the age of 50 have evidence that they had chickenpox in the past, even if they don't know that they had it. Now, while we recover from chickenpox when we're children, the disease we recover from, the virus, however, we don't get rid of. It actually stays in our bodies, Robert, and it goes to sleep basically in our nerves. In particular, in a part of the nerve that sort of resides near the spinal cord. We call it the dorsal root ganglion. And the virus essentially goes dormant and stays there for many, many years, but it can wake up. And when the virus wakes up, this herpes zoster virus, it travels then down that nerve where it was sleeping, and it comes out as a painful, blistering rash on one side of the body. So it could be a nerve that's applied to your chest or your lower abdomen or an arm or a leg or part of your face. And this painful blistering rash is what we call shingles. Eventually it crosses over. Now, it can be absolutely debilitating for a number of reasons. The pain is very difficult to control, and it's very, very itchy. And people, and especially if it's on your face, it can get near your eye, and that can cause problems. And so just the disease itself, the acute disease, which will last anywhere from 1 to 2 or 3 weeks, can be very, very painful and very, very difficult to manage. A lot of itching. People will scratch in their sleep. However, something on the order of about 20% or so, and that number actually goes up as you get older, the pain doesn't go away. It stays for months, if not sometimes for years. And then that's a nerve pain. We call it neuropathic pain. And that nerve pain is extremely difficult to treat. People can have very unusual, debilitating sensations where the wind blowing on their clothes will make them have a pain. Just rubbing a pain. It can feel very, very uncomfortable. And it can happen all day long. And so imagine being in chronic pain for months, if not sometimes years. It can get people depressed. they lose their ability to concentrate. They're not sleeping well. Then they have difficulty going to work if they're of working age, difficulty doing their activities of daily living, and it can be very, very debilitating. And the other thing about this disease is that the risk is related predominantly to age. So why does that virus wake up from our nerves? It has to do with our immune systems declining. So our immune systems tend to keep that virus in check, basically sleeping. But as our immune systems decline, the virus can wake up. And what are the reasons that our immune systems decline? The major reason in the United States and around the world is advancing age. As we all get older, our immune systems get weaker, and that places us at increased risk for infectious diseases. That's why we have those adult recommended vaccines for pertussis and pneumococcal pneumonia and influenza, and also for shingles. The risk for shingles goes up dramatically beginning at age 50. There are 1 million new cases of shingles every year in the United States. The lifetime risk for somebody over the age of 50 to have a case of shingles is 1 in 3. So 1 in 3 people over the age of 50 will get a case of shingles. And for those who are fortunate enough to live to 85, the risk then goes from 1 to 2. 1 in 2 people over the age of 85 will have a case of shingles, and it can be really debilitating, very difficult to manage. And the best thing to do here is to prevent it from starting with. And that's why we have, fortunately, a vaccine that's recommended for everybody over age 50 to help prevent this particular debilitating disease.
Yeah. Now, in order to have shingles, you have to have had chickenpox first. Now, if you have a patient that had shingles and they're exposed to a grandchild, for example, that's never had chickenpox or was never vaccinated, is that child at risk?
So the risk for shingles, as you mentioned, it's related to having had the chickenpox virus when you were younger. So when we look at the blood of people in the United States over the age of 50, the blood assays show that more than 99% of people over age 50 had chickenpox when they were younger. So it makes us essentially all at risk over the age of 50 to get it. Now, the disease itself is not contagious, except if you have shingles and it's in that acute phase and you're around somebody who never had the chickenpox vaccine. Right. So you just mentioned a grandchild. Now, chickenpox vaccines, the first dose is given at around 1 year of age. And so a baby under the age of 1 year would have not had a chickenpox vaccine. And so in that situation, we would recommend that an adult with shingles not be around a baby under a year of age until their shingles acute phase goes over. But we don't consider shingles as a contagious disease. Okay. But rather we consider the risk is to the individual and the outcomes from the individual disease. That's what we want to manage. We're not worried about it being spread. We're more worried about the actual disease and its outcome on the individual person. Right. Now, there's one other group, if I could just mention, that also is at increased risk for shingles, and those are people who are immunocompromised. So I mentioned our immune systems get weaker as we get older, so the main driver behind shingles is advancing age. In addition, there are an ever-increasing part of our population that is immunocompromised due to underlying medical conditions like cancer, for example, or they may be on medications that are very strong immune modifying agents that can be used for diseases like psoriasis and lupus, for example. And in those individuals who are immunosuppressed or immunocompromised, if they get a case of shingles, it can be much more severe. And so that's another group of patients that we are concerned about with getting a case of shingles.
Dr. Friedland, can shingles be treated? Are there antivirals that are effective?
That's a great question. So when a case of shingles is recognized, if it's in the first few days, there are antivirals that can be used that can hopefully shorten the duration of that acute phase by a day or two, and perhaps can help control the pain. However, in general, the treatment of the pain related to shingles is not guaranteed. Not many people do not respond to various medications that are used to help control the pain. And as mentioned, about 1 in 5, and even more so as you get older, we're going to get this chronic pain, which is very, very difficult to treat. So yes, there are antivirals that can be used in the acute phase that hopefully can shorten the course of that acute phase by a day or two. But in general, it's a very difficult disease to manage. And the best thing to do is actually prevent it from starting.
Yeah. Now, let's go ahead and switch gears to prevention. And that, of course, is the Shingrix vaccine. Can you give the listener a primer on this vaccine?
Absolutely. And if you don't mind, I forgot to say one thing that I just want to bring up just to be complete. There is another complication of shingles itself that can be very, very devastating, and it's important that people know about this. If the branch of that nerve where the virus wakes up is on on your face, one of the nerves that's on the face supplies the eye. And if the virus is in the eye, causing a shingles case in the eye, that's an eye emergency. And so if somebody has the rash on their face near their eye, they absolutely need to make sure that they're under care of a healthcare provider to make sure that it's not developing in their eye, because we want to make sure that we preserve their vision during this case. So about the Shingrix itself, the vaccine for shingles. So this is a vaccine that is licensed by the FDA for use in people over the age of 50 to prevent shingles and the complications that can happen from shingles. This vaccine is now also recommended by the Centers for Disease Control for all people who are immunocompetent over the age of 50 in the United States. So this is essentially our entire population over the age of 50 is recommended to have the shingles vaccine. The only one that's now available in the United States is this vaccine called Shingrix, and it was specifically designed for adults. When the trials were studied, we specifically had patients in our trials who were 50 and older, 60 and older, 70 and older, and 80 and older, because we know that the risk of shingles increases as you get older, as do the complications. And so we specifically studied the safety and the efficacy, how well the vaccine works in adults, especially in older adults. And that all that data resulted in this licensure and recommendation for use in people over the age of 50 in the United States.
Now, is the Shingrix a single shot, or is it a series?
That's a great question. So Shingrix is a 2-dose vaccine. So you get your first dose, and then the second dose is given anywhere from 2 to 6 months after the first dose. And so it's a 2-dose vaccine. The full level of protection that was demonstrated in the clinical trials and now in the follow-up that's being conducted is with both doses of the vaccine.
Yeah. And you kind of touched on the efficacy and the safety. Can you expand upon that right now?
Oh, absolutely. So let's start with safety, because it doesn't matter if you have an effective vaccine if it's not safe. So more than 30,000 people were studied in our clinical trials, and now we have many, many millions of people who've received the vaccine here in the United States and around the world. And so when we look at the safety of the vaccine in the people who've received the vaccine, the safety is judged to be essentially what you would expect from this vaccine. So patients report, and myself included, I received the vaccine. Typical reports are pain at the injection site, redness and swelling, and sometimes some headache, some fever, feeling sort of tired and weak. Those types of symptoms can be more common after the second dose of the vaccine. And it's very important to know about this, because we want people to understand, and it was important that I knew this was going to happen as well, that when I had that happen to me, I had pain, I had headache and not feeling well after the second dose. Instead of thinking, oh, something went wrong, I knew that this was related to the vaccine. Typically lasts anywhere from 1 to 3 days after the vaccine, and then will go away. So I knew what to expect. I was ready for it, and so therefore I knew that this was what was going to happen, could happen after the vaccine. We tend to see less of these reports in people who are older, let's say in their 70s, versus people who received the vaccine in their 50s. And so that's the safety profile. And everything that we've seen since the vaccine has been used for the last 3 years here in the United States is consistent with exactly what I said. Now, about how well the vaccine works, which we call efficacy. The vaccine is highly effective in adults, including in older adults over the age of 70 and over the age of 80. Clinical trials demonstrated the vaccine was more than 90% protective in preventing shingles and the complications related to shingles. And the vaccine is also durable. In other words, it lasts. The protection lasts. And this is held up since the vaccine has been now widely used over the last 3 years in the United States. So we were extremely, extremely proud that the science behind the vaccine developed a vaccine that was highly effective and safe in adults, especially older adults. And that's what resulted in the Centers for Disease Control recommending the vaccine Shingrix for everybody over the age of 50 in the United States who's immunocompetent.
Excellent. Well, Dr. Friedland, I want to go ahead and give you the floor if there's anything else you'd like to say about shingles or the vaccine.
Yeah, thanks. So as we put this all together, I want to sort of come back to in the beginning when we were talking a bit about COVID. I'd say that now is the time to plan to get all of the adult recommended vaccines, including the vaccine to help protect against shingles, because we don't know exactly when we're going to receive our COVID vaccine. We're all looking to sign up and get on a waiting list to get the vaccine. And so, we may get our COVID vaccine a month from now or 2 months from now, or perhaps 3 months from now. And so while we're waiting, let's get ourselves caught up, because we know that adult vaccination rates have declined dramatically during the pandemic. And so I would recommend that listeners, we should all be in touch with our healthcare provider, our doctor, our nurse, or if we're in the pharmacy, we could ask the pharmacist, what are the recommended vaccines for adults? And then check, did I get my Pertussis vaccine? Did I get my pneumococcal pneumonia vaccine if I'm over the age of 65? Did I get my shingles vaccine if I'm over the age of 50? And if the answer is no to any of those, go ahead and get those scheduled and get those vaccines now, so we can plan to be up to date, so that when it comes time to get the COVID vaccine, we've already had all the other vaccines sort of done with. And because we want to make sure that we protect ourselves against all of the vaccine preventable diseases, because our goal, I'm getting older myself, and I want to have every opportunity to stay healthy. And I don't want to come down with a case of pneumococcal pneumonia or with shingles. I can tell you a personal story. My mother-in-law had a case of shingles, and when she was 84, and it just threw her for a complete loop. For about 2 months, she was just completely not herself. Life essentially stopped. She had it on her face. It was near her eye. She had to make sure that her eye was fine. There was a lot of visits to the eye doctor related to this. Controlling the pain was extremely difficult. Ultimately, it was a pain management specialist who was able to get her pain under control. And basically, she lost a good at least 2 months, if not longer, of living her life. And it was very, very it was scary for her and for her family as well to see her go through this for something that's vaccine preventable. So that's my recommendation. I'd say now's the time to plan, get completely up to date on all the adult recommended vaccines, including that for shingles and people over the age of 50, before we're able to get our COVID vaccine. So let's get this sort of done with and completely up to date, recommended with all the vaccines. And then when it's time for COVID, we can get that as well, and hopefully move on and live our lives in a healthy, safe way.
Great advice. And I wanted to thank you, Dr. Leonard Friedland, for sharing your time and your expertise.
You're so welcome, and have a great day. And thank you for your interest in talking about adult vaccines and shingles.
Thank you, sir.